Hello, this is Pastor Terry Goodman, and I want to welcome you to the Wesleyan Connection. This podcast is primarily for the clergy and laity of the Holston Annual Conference. Join with me now as I take a look around the Connection and share some of the things happening in the churches of our annual conference. One of the important benefits that the annual conference offers to its ministers is health insurance. It's also a rather complicated process to understand some of the complexities of the health insurance plan that we have. So I decided to go to the source. Ken Luton, who is in charge of administering the benefits and asking questions. He is at our conference office, and I was at the office recently for a visit in the afternoon, so I asked Ken if I could sit down with him for just a few moments and talk with him about our conference health plan. And so I hope you enjoy this interview and find it enlightening, because there are some major changes that are happening that all of us should be aware of as we plan for 2017. So hope you enjoy this conversation. There we go. Okay, I'm here talking with Ken Luton. What's your job description here? What do you do here at the annual conference for us?
Well, my job title is Conference Benefit Officer, and in that regard, I manage the administration of the conference health plan, both for active clergy and participating lay employees at local churches, and the administration of the pension plan, billing and coordination of benefits with the WestPath, formerly known as the General Board of Pensions and Health Benefits in Chicago.
Okay. So working with the insurance benefits, one of the things I noted at annual conference this year is that we are undergoing some changes in the plan. There's an S plan and a P plan, and we've got some decisions we're going to have to be making about that.
Well, in discussing anything financial, it's important that we understand and have correct semantics.
Okay.
So when we say plan, let's identify first off what a plan is. Our plans are the schedule of benefits that we offer through Blue Cross Blue Shield to participants. That's office visits, mammograms, specialist exams, that type thing. That is a plan.
Okay.
And on our website, we have a full description of what those benefits are under those plans. What was announced at annual conference was that we were going to start utilizing two networks. And these are networks of participating providers, doctors, hospitals, clinics, whatever. Two different networks that Blue Cross Blue Shield has in the state of Tennessee.
Okay.
Our base network that we have adopted is called the S network. As an option, we are offering what Blue Cross calls their P network.
Okay, and so there's a difference between those two, obviously, or else there wouldn't be a base and an option.
That's right. The differences does not affect the benefits that participants have.
So I'll be able to get the same thing that the plan calls for on both of those.
That's correct.
But there's going to be, what the difference is, the doctors that provide them?
The difference is that some providers in the state of Tennessee only accept or are under the P network.
Okay.
And P network reimbursement rates to these providers are greater than the reimbursement rates under the S network.
Are we currently under one of those networks now?
We're currently under the P network.
Okay, so that would be considered our base sort of now.
Through December 31st, that is our base network. It is the only network that we are enrolled in.
Okay, but as January 1st, we're going to have to decide whether we want to be S or P then.
That's correct.
And the difference is that some doctors will not. It sort of depends on the doctor you're going to. You need to figure that out.
That's correct.
What they accept.
We're sending out tomorrow our open enrollment package that will include very simple, detailed instructions of how everybody can go on the Blue Cross Blue Shield of Tennessee website, look up their individual providers that they use, and they can determine what networks those providers are in. If a provider is in the S network, pretty much in all cases, they will also accept P network plans.
Or the benefits. I guess when you get these networks, basically it means that...
Now, don't talk benefits.
Okay.
Benefits do not change.
Okay.
The only change is what the doctor gets in a check from Blue Cross Blue Shield.
Okay. What's the term that we use for that then?
Reimbursement rates.
The reimbursement rates are different then.
That's right.
So, the difference between the two networks is that one does... You can go in for the same procedure and one network would reimburse at one rate and another network would reimburse at a different rate?
That's correct. The S network reimburses the doctors at a lesser rate than the P network.
Sounds like that saves money for the annual conference when that happens.
It's estimated that it should save the conference between $400,000 and $500,000 in the year 2017.
Okay, and that's important for us because we are self-funded. Is that correct?
That is correct.
For those that might not understand that term, how does that work?
Blue Cross Blue Shield sends me an invoice every week, and we write them a check for all the claims. They administer the claims. All the claims are filed through their administrative facilities in Chattanooga.
So, in other words, we are responsible as an annual conference for the claims, and we pay those from the monies that are collected from the premiums?
That's correct.
So, if we run out of money in our funds, then that means that we no longer have insurance? Is that what would that be one way to look at it? Once the funds are gone?
In any self-funded plan, it's incumbent on the conference or any others that we have adequate reserves to take care of those situations. Where from year to year we may lose money. We may have more claims and costs than we have premiums collected. And in those cases, we dip into our reserves to make up the difference.
So this S network basically is a strategy our conference is choosing to help us continue the viability because it's going to reduce the amount that we have to pay out.
That's right.
Okay. Are there any other differences between S and P that we need to think about?
None whatsoever.
So in other words, I need to look and see which doctors in Tennessee that brings up the interesting question. I don't live in Tennessee. I live in Virginia, but I live close enough to Tennessee that I have some Tennessee doctors. So in Virginia, how does it work for the Virginia ministers?
For participants that use providers outside of the state of Tennessee, there is no distinction.
Okay.
If all your doctors are in Virginia, you can go with the S network, and they'll more than likely be reimbursed at P network rates. But it's seamless and totally transparent to you in Virginia, Georgia, Alabama, Kentucky, wherever that provider may be.
But for those pastors like me that are close enough to the state line that some of our doctors are in Tennessee, I need to find out from that doctor if they will accept S network benefit, or no, not benefits, S network reimbursable.
That's right.
Okay. So that's an important distinction to make. Another thing I noticed at that annual conference was that there was this, I don't know if mandatory is the right word, physicals that are required next year. It's not mandatory, but if you don't do it, there is a extra financial cost. Is that right?
That's correct.
How does that fit into the scheme of things? Why are we doing that?
One of our benefits under under our plans is called wellness benefits. And a wellness exam is at no charge.
Okay. But now you're wanting to make sure that we do it.
That's correct.
And if we don't
if you don't do it, it's going to be an extra premium in the year 2018.
Okay. Like I have a family of 6 and I'm on a family plan.
That's right.
Does everyone in the family have to get that?
Just you and a covered spouse.
Me and a covered spouse, okay. And what is the increase that's going to happen in 2018 if we don't do that in 2017?
It'd be $75 a month.
Is that per person or
That's
just
per participant?
So if I did it and my wife didn't, it would be $75 because she didn't.
That's correct.
If neither of us did it, it would be $150.
No, it'd still be $75.
Still be $75. Okay.
Because the participant didn't cause compliance with that requirement.
Okay. So in other words, I've got to make sure that both spouses or both adults get that physical at some point during 2017 to avoid an increase in 2018. Okay.
Right. Now the cutoff for that is July 30th.
Has to be before July 30th of 2017.
That's correct.
I didn't realize that part. I hadn't read close enough to find that out. Okay. That's good to know.
Now, in getting this done, it's important that when you go in and you schedule this appointment with your doctor, you say this is a wellness exam. If you say this is an annual physical, that's a whole different reimbursement code.
Okay.
I want to schedule my wellness exam.
Okay.
There's no difference in what they're going to do. As far as testing,
they're going to code it differently.
They're going to code it such that we capture it as a wellness exam for each individual, and there's no charge. So if you go in for this exam and they are asking for a copay, you say, whoa. Unless you're having some other procedure done. If you're going in for your wellness exam, they're going to x-ray your hip because you're having trouble walking. That's a whole different ballgame. But you want to make sure that they code this as a wellness exam so that there's no charge.
Okay.
And that we capture it as such, or Blue Cross Blue Shield does. And I have the ability to go in every day and see who's gotten their physicals or gotten their wellness exams.
Okay. So that's important to make sure we use the right terminology and get everything recorded.
Like I said, going into our discussion, terminology is critical in dealing with healthcare issues.
Mm-hmm. I know that sounds like it sort of ended rather abruptly, and it did because I sort of have a time constraint that I have to fit these podcasts in. So we did complete everything we wanted to talk about in terms of health insurance. The next podcast is going to be about pensions. So make sure you listen to that as we talk with Ken Luton next time about pensions. This is Pastor Goodman. Thanks for listening to this edition of the Wesleyan Connection. Be sure to check back often for more podcasts.